Hi, I'm Courtney Stewart, and this is my informative speech. Alright. Schizophrenia refers to split personality or multiple personalities. This is a myth. People with schizophrenia refers to they're more split off from reality. Some of you may know someone with schizophrenia or suspect them of it, and it's good to know a little bit of background information. So today I'm going to tell you about the treatments and symptoms of it. What is schizophrenia? Schizophrenia is a brain disorder, and it affects the way people think, act, and the way that they see the world. It is a altered perception of reality, and it appears mostly in late teens and early adulthood, and it's more severe in men than it is in women. There's 3 steps when dealing with schizophrenia. The first step is to identify the signs and symptoms. The second step is to seek help. And the third step is to stick with the treatment once you figure out which one that will be. Warning signs, there's several warning signs. A few of them are social withdrawal, hostility, the inability to cry, so you have lack of emotion, and a lot of them are paranoid or depressed. For example, there's a life story that is about a kid named Daniel, and he was 21, he was in college, and everything, working hard, he had no problems at all, worked at an electronics store, and then all of a sudden, gradually things were changing, and he just became extremely paranoid. He thought that everyone was out to get him, and at work, he thought that people were looking at him and watching him through surveillance cameras, and he just freaked out, and he started screaming and yelling and breaking TVs, and it worried his boss, and he ended up calling the police, and then Daniel was hospitalized. So that's just an example to show that a lot of time you don't know that someone's going to have schizophrenia. It just gradually changes over time, and you start seeing symptoms. 5 of the main symptoms are delusions, hallucinations, disorganized speech, disorganized behavior, and negative symptoms. Delusions, there's 4 different types. There's persecution, which is when they think that someone's out to get them. There's reference, which is messages that are meant for them. For example, when they're watching TV or they see something on a billboard, they automatically think that the message that's said is being pointed towards them. A grandeur is the belief that they see someone and they think that they're a famous person or someone of extreme importance. And then the control is just thoughts. They think that their thoughts are being controlled. Hallucinations, there's hearing voices, visual hallucinations. Most of the time, it's a voice of someone that they know, and the voice is very critical and vulgar and just mean. They're just to the point. Disorganized speech is when they can't concentrate on a thought. They have jumbled sentences, shifting topics back and forth, make up words, and then sometimes they have meaningless rhyming. So they'll say, for example, sentences like, I fed Ned bread in the shed. That's something they just decided to make up. Disorganized behavior, that's pretty self-explanatory. They have unpredictable emotion. They have a decline in their daily function. And then negative symptoms, that is lack of emotion, lack of interest in self-care. So they just don't care about the personal hygiene anymore. They stop shaving, they stop bathing. Lack of interest in the world. They have social withdrawal. They just isolate themselves from everything. And then speech difficulties. They're monotone. They can't carry on conversations. There's just not anything that a healthy, normal human being would have. The 3 main types of schizophrenia are paranoid, disorganized, and catonic. And the 3 causes are genetic, environmental, and abnormal brain structure. Genetic is if you have a relative or sibling or a parent that has schizophrenia, you have a 10% chance of getting it yourself, as opposed to the rest of the world, which is 1%. Environmental, research has shown that 10% research has showed that high levels of stress can cause schizophrenia. So anything about pregnancy and prenatal issues, or losing a parent at a young age, that can cause schizophrenia. And then abnormal brain structure. There is enlarged brain ventricles that appear, and people who have schizophrenia have low activity in the frontal lobe. The treatments, there's two different types of treatments. There's medications. There's atypical antipsychotics, which has low risk of side effects, and there's conventional antipsychotics that have significant amount of side effects. And then also last is psychosocial treatments. This is basically just therapy where you go one-on-one with a psychologist, or you can go in a group setting with other people. So today I've informed you about some background information on schizophrenia. Just remember that people with schizophrenia are not dangerous. They have bad thoughts and hallucinations that can lead to bad behavior, but they don't usually set out to harm individuals.